welcome. I'm Jeff Carr. We're here at the SCCT in Montreal, 2013, and I'm here with Dr. Vinay Malhotra from Tacoma, Washington. Vinay is head of our Advocacy committee at the SCCT, and Vinay, would like to get an update from you on what are your activities with Advocacy.
Thank you, Jeff, for introduction. At the SCCT, as you all know, our society is not just dedicated to the mission of education, to disseminating information about CT, but also looking at public health policy and trying to reduce downstream testing, improving outcomes, and as part of that, advocacy comes into play. And at Advocacy, what we are trying to accurately estimate and account for is what does it take at the ground level to do a very high quality CT. How many people does it involve? What kind of scanners do you need? What kind of protocols do you need? How do you work on radiation safety? All of that comes into play when you're trying to achieve a high quality study that can then lead to a good outcome for both the patient and for public health policy by reducing readmissions, reducing downstream testing. So it's a big agenda, but that's what we deal with.
So Vinay, the SCCT is an international organization. You know, we have members from China, Asia, South America, Canada, Europe, Middle East. Healthcare systems vary, and you know, one of the advantages of coming to Montreal or in 2014 coming to San Diego, where the SCCT will be, is that we bring all these viewpoints together and we can kind of share and do best practices from an advocacy point of view. What does that mean and how does that work?
I think this is a very good example of a society that is truly international. We know there is care variation between different geographical areas, between West Coast, East Coast, Midwest. But like you pointed out, you have differences in different countries, in England, in Canada, in Germany, Middle East, Australia, etc. And what we can do is bring the best from all of those places into our society and help improve the protocols, which will then lead to better outcomes. So, you know, in many ways, I'm fortunate to be in a society that is truly international, that has all these various representatives, and I can use their expertise to reduce care variation and improve outcomes. So I think I would love to hear from anyone and everyone who is involved in this field to help our society help improve outcomes.
Well, Vinay, great. I know the leadership really appreciates all the work that you've done over the years. And are there ways that individuals can get engaged with advocacy?
Absolutely. We're looking for volunteers at any time. And you could be in any part of the world. Like I said, this is an international society. If there is any way you think you can help us, please look us up. You can send us an email, info@scct.org, and you can get in touch with our CEO or any one of the board members or myself. And we'll be more than happy to take your input, engage you in any way we can in the committee, and help broaden the mission and also the reach of our society. I think you can make a difference.
Thank you, Vinay. And again, this is Vinay Malhotra and Jeff Carr. We're in Montreal at the Society of Cardiovascular CT, SCCT 2013. Thank you.
Thank you.